Hello, welcome to office hours. Ask me your weight medicine questions. If you are confused about your weight, if you have questions about weight medicine, and if you want medically based answers to your weight questions, you are in the right place. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications. I actually talk to patients about their weight all the time. And I've helped hundreds of patients lose weight, and I'm here to help you too. Today, I'm answering some excellent questions that were sent to me. And if you have questions after this, please feel free to leave your questions in the comment section below. This will be posted on my YouTube page, Weight Medicine with Dr. Meghan. So I'm always delighted to answer your questions. And I can't answer personal medical questions, but so I might change your question a little to make it more broadly applicable in terms of education content. So let's get started. So, first question, this is about stomach paralysis and Mounjaro. Um, as someone who has dealt with this condition for almost 8 years, I can tell you it is not paralysis and it's a motility disorder. People fail to realize that one of the leading causes of gastroparesis is from type 2 diabetes. If you have someone with type 2 diabetes who's taking this drug, it's highly possible it's just creating a perfect storm. Yes, that is an excellent point that if somebody, so diabetes in and of itself is going to, can cause slowing of the movement of food through the stomach. That's just a side effect of diabetes and how it works on the nerve system in the GI tract. So that's already an issue for some people who have diabetes. And then if they're taking Mounjaro for their diabetes on top of that, it could definitely make it a lot worse. So that's something to be aware of. This is really for people who are, taking the diabetes version of the medication for that condition. So Mounjaro, Ozempic, Victoza, medications are all the same, but you're just going to be taking a different name of the same medication. But yes, if you have diabetes, you're already, at a higher risk of gastroparesis, which is when food moves more slowly through the GI tract, more slowly through the stomach. You're already at higher risk of that. And then when we add something like Mounjaro or like Ozempic on top of that, your risk is even higher. So yes, definitely a great thing to be aware of. Okay. I started my I think this person is on Mounjaro or they're on tirzepatide. I started 7.5 after week 3. Oh, okay. For two reasons. I was going to a wedding and didn't want my first shot the day before. Two, I wasn't losing weight on the 5 milligrams. No side effects on the 7.5. I feel like I'm melting each day. I don't know. Is that good? I don't know. Um, this Thursday is shot day. I'm thinking of going back to the last 5 this week. What should I do? Okay. Essentially, this is a question about kind of jumping around on doses. And I'm a little confused because uh, maybe this person is talking about like they were on the 5 for a while and then after week 3 of the 5, they went up to the 7.5. I think that's what you're talking about. Not that your week 3 dose of the medication to begin with was at 7.5. That would be very bizarre. You would definitely, under normal circumstances, you would go 2.5 for a month at least, 5 milligrams for at least a month, and then the 7.5. So it sounds like in this scenario, if someone was on the 5, but after they went up to the 7.5 after the third dose instead of after the fourth dose. So personal dosing questions you definitely want to check in with your doctor about and make sure they know what's going on. If somebody's kind of jumping around, it also depends on supply too and what's available. So sometimes, people, they go to refill the 5 and then only like the 7.5 is available. So there's lots of reasons why, especially now with the shortages, people might be jumping around in a way. Like in a way that's not like the ideal way to prescribe. And it's just kind of make it work time. So if I had somebody who was doing really well on the 7.5 and for whatever reason they had to go up a shot early, if they are doing well on the 7.5, I'm not going to have them go back down to the 5. If someone is on the 7.5 and they're not doing well, it's always, you can always backtrack and go back down to the 5. And maybe, some people just need to be on that lower dose for longer to let their body adjust. So I can't answer this personally, but I will say, uh, sometimes we just have to play around with the doses, but you definitely want to make sure that if you are kind of moving doses around, that you're checking in with your doctor and that they're on board with the changes that you're doing and that everything is safe and that you're tolerating it well. So again, always great. Also a plug for making sure you're getting your medications from a reputable source. You're getting them prescribed by a physician who can monitor you. So always a good idea. Next question. What if I cannot take Mounjaro? Caused gastroparesis, nausea, vomiting, major abdominal pain. It was helping so much for about 4 months. Went down to 2.5 for a month and still had the symptoms at the 4th week. Yes, so sometimes Mounjaro is not going to be, or tirzepatide or Zepbound, whatever it is for you. It's all the same medication. Sometimes it's not going to be a great fit. But if somebody, uh, if it was really going well for somebody for 4 months and they go up to the next dose and then it's not going well, it's definitely a good idea to try to back down. And it really depends on the severity of your symptoms in terms of how long you want to give it a go. So let's say I had a patient that, they're doing well, 2.5, 5, 7.5, and then the 10, and they're like, whoa, time out. I'm just miserable. Definitely, I would have them back down to the 7.5, and they might be on that for a couple months because these are lifelong medications. So the goal is, seeing if this is a good fit, and sometimes it just takes a little while. Now, if someone is on the 7.5 and they feel like they have food poisoning all the time, I'm not going to keep them there. So you might back down to the 5, you might back down to 2.5. So the key is, seeing this is the severity of the symptoms are really important in directing how you're going to go. And then I really try to give it a good, like, as long as possible before taking somebody off. Again, it's very patient dependent. And some people will just say, what, I do not want to try this medication anymore. Great. Okay. That's totally fine. And you don't have to. But I definitely have patients where like they do have a rough couple months, but then their body adjusts to it. So it's all kind of, depends on the severity, depends on how willing the patient is, depends on the supply, if they're not tolerating it well, they want to keep trying and it's just not available anymore. That kind of answers your question too. So for people who, tirzepatide is not a great fit, those patients can always think about semaglutide, whether, it's going to be the weight version or the diabetes version, depending on what somebody has, but that's going to be either Ozempic or Wegovy, or they can certainly try the liraglutide as well as Saxenda or Victoza. Or, I definitely have some patients that they just aren't a good fit for any of the injectable medications. Usually these are people who have pretty significant underlying GI issues. And so there are definitely oral medications as well that you can talk to your physician about. So if the Mounjaro doesn't work for somebody, it's not like there's many other options. So don't give up. But if you've given it a really good try, feel like you've done everything that you can do and it's not a good fit, don't worry. There are other things out there. Great question. Thank you for sharing. Next question. What about bladder pain? This is with Saxenda. Will it go away? Should I consider stopping? I started to get the pain, full pressure, about 10 hours after the first dose. It has not gone away now, 10 days, no other side effects. So, sometimes for patients, the abdominal pain or the abdominal discomfort is going to show up in different areas. So it might be lower abdominal pain, it might be upper abdominal pain, it might kind of the cramping might be kind of generalized. It really depends on the person. Um, I don't really like bladder pain. I always wonder, especially with people who are on these medications, you have to worry about getting dehydrated. You have to worry about fluid status. So, um, I would definitely, if someone had specific bladder pain, that's, you want to make sure you're checking in with your doctor because, there's generalized stomach pain, but I don't usually see, personally, clinically, bladder pain isn't something that I'm necessarily expecting these medications to cause. Again, there's, lower abdomen, it's kind of a fine line between is this stomach, is this pelvic? Certainly, there's, constipation that can come up that can cause kind of lower abdominal pelvic pain, diarrhea, cramping, you can get that in that area too. So, um, for people, if someone came to me and they said they had bladder pain, I definitely want to look at other causes outside of this medication. I feel, it's easy to kind of hang your hat on that if you just started taking it, but there's a lot, there's a lot of other things this could be, and other things that the medication can cause. So I would just be careful if you have bladder pain. I would check in with your physician and make sure you're doing a workup for other possible causes as well. Great question. All right, that's going to do it for today. Thank you so much for watching. If you have questions afterwards, please leave them in the comment section below. If you want to work with me, I'll leave that information down below as well. Thank you so much for watching, and please be well. Bye.